Greetings and salutations, one and all. Welcome to today's webinar, The Ransomware Epidemic Protecting Healthcare in 2025. I am Jeffrey Wheatman. I am a Senior Vice President, Cyber Risk Strategist at Black Kite. And really, all that means is I get to hang out with some people that are way smarter than I am. And today, I am honored to be joined by Ferhat Dikbiak. And I know I always butcher his name. I get Ferhat right. I think we just got to call you Ferhat going forward. Um, Ferhat is our Chief Research and Intelligence Officer, and he runs our Bright Research team at Gartner, which is actually at Black Kite, which is what we're going to be talking about today. And then I also have with us today Bob Maley, our Chief Security Officer, who has a long and storied career. So welcome, gentlemen. Say hello and wave to all of our attendees.
Hello, attendees.
Aloha.
All right, Bob, contrary to Bob saying aloha, he is not in Hawaii at the moment. So thanks, guys, for joining. I am actually super excited about today's session. So let's kick off with Ferhat. So we have this great report that we just put out on ransomware, and we have identified a couple of things which Ferhat's going to talk about. But I think what would be helpful, Ferhat, tell us a little bit about sort of the origin and history of this research that we do at Black Kite every year.
Yeah, I mean, we always monitor these ransomware groups. I have a cybersecurity research team. They monitor the ransomware actors. Currently, we monitor around 130 ransomware groups, and last time I checked, like 60 of them were active, meaning that they published at least one victim in the last 12 months. When we analyze these ransomware groups, we also analyze the victims themselves. Like whenever they publish a victim, we go through the victims industry, country, annual revenue, their cybersecurity posture, what are the weaknesses that they had before the incident. And we start to see these uptick on the healthcare part. And around that time, I was invited to a talk in a medical faculty of a university, and I dive into the details. And I realized that when I look into data from a quarterly perspective, in the first quarter of 2023, healthcare was number 7 when we ranked the industries targeted by the ransomware groups. Then in the beginning of the 2024, they jumped to the number 3, and then they stayed at the number 3. And I know the reasons, and we will talk about the reasons a lot, but that was fascinating to see that the healthcare is actually under the ransomware epidemic right now, and the number of victims increased a lot throughout the year. And the share of the healthcare victims is 8% when we look into all the victims, but number of victims almost doubled, increased by 30% when we compare 2023 to 2024.
All right, great. So, Bob, let's kind of hustle to you. So, Bob, you're a practitioner, right? You run our cybersecurity program and pretty much everything IT related at Black Kite, and you've run programs elsewhere. You built the third-party risk program at PayPal. You were the CISO for the Commonwealth of Pennsylvania. So, as you read these reports, I have 2 questions. So number one, what is the value of this kind of research for you as a CISO, as a practitioner? And then what are kind of 3 key takeaways that you can sort of share? And then what's one insight? So something that's implied, but isn't necessarily explicitly written. So I know that's like 3 questions actually,
Yeah,
Bob. So
let me deduct that
go.
from your bank, okay? All right. All right. So, I've always been a big proponent of the value of your research. And I talk a lot. Anybody that's heard me speak, I've written a book about the OODA loop, observer-oriented side and act. And, in agile risk management, cybersecurity, that observation phase, the collection of information is critical. And it can be very challenging because, I go back 28 years ago when I was doing digital forensics, and the challenge was, oh my, hard drive is getting close to a gigabyte. How do you do that? So, the analysis of data for a CISO is challenging, and a team like Farhat has, they put forth all that effort. They do all that groundwork, the high caliber, effective research that has meaningful information. That's the value, because after all, when you're trying to understand your program as a CISO or as a third-party risk manager, where's the threat coming from is extremely important. How they're doing it's extremely important, and that value. For me, I love the report. I get to see it ahead of time. And I've been with Black Kite 6 years, and I've been since day one a big proponent of that research. It's really valuable. So that's question one. Question two, I gotta be honest with you, there weren't a whole lot of surprises. I've been doing this stuff for a long time, and I've gotten to a point where I would be surprised if breaches are going down, if the threat is reducing. Those would be the surprises. But I looked at a couple takeaways for me that the significance of in the report is called silent breaches, and it's something as a CISO we all know dwell time. How long have the bad actors been in our network? We don't have enough time to go into some of the things that I've seen happen with dwell time, and one of the largest breaches I think as of in 2016 or 2015, it was the largest breach ever, and I had some background insight into the dwell time. So that's still bad. That's a threat. And when ransomware's continued dominance here. It's like, okay, when is ransomware going to be old hat? When are the bad people going to find out a different way to attack
Well,
us?
apparently next Thursday. That's what I heard. Next Thursday, everything is going to be fixed.
Next Thursday, and I have, and I'll maybe talk about it a little later, but I have some ideas, and I think I understand why it hasn't. But the report also shows some of the things in there that a takeaway is companies that are being more proactive. I believe are probably less inclined to become victims. But I think the one key thing out of the whole thing is that proactive third-party risk management, it's not optional anymore. It's essential to be able to survive in what's going on out there.
Right. I mean, I tell people all the time, I say, look, you may be perfect at protecting yourself against ransomware. You're not, but you might be. But I can guarantee your partners, they are definitely not.
Yeah.
And I always say, like, if one of your key vendors partners is down for a week, how bad is it for you? And the answer is generally longer than a week. So, and I love your take on sort of the whole concept of research. I mean, that's how I lived my whole career, right? Is looking at information and data, and Farhat and his team have done an amazing job taking just a huge amount of data, like ones and zeros, and really turning it into actionable intelligence, which leads me to my next question for Farhat. So why is healthcare such a challenge? Why do they continue to struggle in that industry when one would think, because of the data they have and the criticality, that they would actually be top of their game? So what do you think the cause is that they are still coming out, quote unquote, at the top of a list that you do not want to be at the top of?
Well, let me backtrack a little bit and tell you that why they are in the top, right? Then I can move on to the practitioner part. But the healthcare is in the top because something changed in the ransomware cybercrime business ecosystem. I call it the business ecosystem because they are financially motivated groups. They run their things like a business. They don't even call it ransomware. They call it post-paid pen test services. So they think that they are doing something good. And I see ransomware groups like they even published post attack reports, like a very detailed cybersecurity report. Hey, we access first this server, then we move to that one, kind of things, because in their mind they are doing something good. Anyways, but what happened is that until these Operation Chronos that disrupted these major ransomware groups, Lockbit and Black Cat, these groups, they had some sort of a twisted code of conduct. They said that they don't attack nonprofits. They said that they don't attack healthcare hospitals. Of course, they are working with affiliates. Lockbit was at some point they were working with hundreds of affiliates, and they cannot control affiliates. If an affiliate attacked a hospital, for instance, Lockbit did that, and there is some other group, I think it was Play. They also did that. They published apologies saying that, hey, they apologize that happened here is a free decryptor. They are like they are like a company providing a PR moves and like these marketing moves and everything. But with the Operation Kronos, law enforcement agencies all around the world disrupted these big groups, and Black Cat they spoke. They said that they need to exit from this ecosystem, but they need a one final hit, and they attacked Change Healthcare. Change Healthcare itself is not a healthcare institution, but it's a very critical vendor in the healthcare ecosystem, right? And they allegedly collected some ransom amount, and they didn't pay the commission to the affiliate who executed the attack. So in the ransomware cybercrime business ecosystem, the commission payment is the real business model, right? In the years ago, the commission to the affiliates was 30%, 40%. Last year it was 70%. But after this, the affiliates they now think that they need to get paid quickly, and they start to work with multiple ransomware groups. And there's one ransomware group. It's not, right now is the number one ransomware group called Ransom Hub. They emerged suddenly out of nowhere, and they said that they are going to pay 90% commission to affiliates. There is no restrictions on the targets. They can attack, healthcares and others. And the affiliate will get the money first, and then the ransomware group will get their cut. So these changes in the ransomware business model make it an open season for the affiliates. There is no restrictions. There is no targets. They can attack everywhere. And the healthcare kind of like a low-hanging fruit for them. And in fact, if you look into the report, one, I think, surprising result is that all the healthcare victims, 22% of the victims are hospitals. You expect that it will be a larger share, but 25% of the victims are offices of physicians. We are talking about like these small clinics where there are only a couple of doctors and some employees, and they don't know anything about cybersecurity, right? Maybe they rely on some small companies to take care of that. Maybe they don't even think about the cybersecurity part of it, and suddenly they cannot, operate. They cannot write prescriptions. They cannot do their business. And for them at that moment, the pressure is that they just need to pay the ransom to get going. And these ransomware groups, then when they realize that it's very easy to get the money from these, offices of physicians, then we start to see these, uptick now, more and more, healthcare victims coming in our way because of that. Even for the hospitals, even they invest a lot on cybersecurity, there are problems. For instance, there's a critical vulnerability exploited by the threat actors, right? You need to update all the endpoints in a hospital, but there are surgeries going on, right? There are systems that you cannot shut off, like shut down and do the patch. And so it is very difficult for them to react to these things very rapidly. So that's why the healthcare is kind of a low-hanging fruit for the ransomware groups, and that's why we see this increase. One other thing, I want to say that the other stats that is quite surprising for me is that the reporting, right? In the past, we see that people do not report when there's a ransomware incident, even though there are regulations around it. And in 2023, only 37% of the real victims reported. In 2024, that ratio is 61%. So it is doubled in 1 year. So that's a good thing. The only good thing that I see from the report is that people start to report more, become more transparent. And when you report, there is nothing to hide. Maybe you don't have to pay the ransom at that point.
Right. So that's really interesting, because I think one of the things that we need to move away from is the stigma of what of being attacked, right? If nobody declares and nobody talks about it, everybody else is caught flat-footed. So that in theory, you look at that stat and you go, oh, that's bad, but really that's good because it raises awareness. So definitely like to hear that. And I just, you hit on something that's really important, which is the fact that there are operational medical things going on. Many years ago, I was in a meeting at a hospital with a CISO, and we were talking about their program, and the door slams open, and a doctor walks in, and he's wearing his scrubs, and he's like, my system went, the screensaver kicked on in the middle of doing surgery, right? Well, the policy said if the machine doesn't get touched, a screensaver kicks on, but nobody bothered to talk to the people in the ops theater. And this poor doctor basically had to hit a mouse and then scrub back in, right? So these are really, really important things. And I love that you brought that up. And then one thing, and this is actually, I think, for both of you, maybe I'll hit Bob first. So there's a new HIPAA version coming out, right, which covers healthcare in the U.S. Do you think, Bob, the new HIPAA regulation is going to address some of these things, or do you think it's going to continue to be sort of, business as usual?
Okay, so yeah, you shouldn't ask me about regulations and frameworks. Yeah, I think regulations and frameworks are what Bruce Schneier calls security theater. It's something that it's a baseline checklists that it's the least agile thing you can do. It's minimum. Obviously there's a lot of things you should be doing, but yeah, I really don't see that having any significant effect here. Farhad, I like what you said about the hospitals. I actually spent time in healthcare before I was a CISO in Pennsylvania. I saw it three ways. I saw it in a healthcare system as a network engineer, and I was a director of IT for a state agency that oversaw healthcare, and then I was a director of IT at a hospital association. So I haven't seen a whole lot of change over the last 30 years there because the nature of healthcare. They are so dependent on third parties for everything. And and I can't imagine it's changed a lot, but I remember being in the health system, how many different systems were connected together, one for radiology, one for this, one for that. Had to have the VPN over to Australia so the radiologist over there could read the images in off. I mean, it extremely complicated. And you're right, that makes it that, it's critical what they do, and it makes it that low-hanging fruit that they need to be up and running.
Yeah, and I'll tell you, my daughter is actually going through a program to be a physician assistant, and she told me she's actually doing her surgical rotation, and she said there have been days where literally all she did was sit in the dark looking at a computer monitor because it's robosurgery or arthroscopic, and the dependency on the technology. And
Yeah.
let's not even get us started on the lack of security within medical devices. So. Farhat, do you see any changes sort of in the future, either because of regulation or not? I mean, we know they're declaring better, they're talking about it, but are they getting better? And do you see a future where they actually can sort of get a better handle on this?
Well, I can say this, like bad days passed, worse days are waiting for us. Because like, if we don't think about proactively, if we still think the ransomware is a reactive thing, like, you will react when it happens thing, everything will go worse. So we need to understand the risk. We need to understand how to measure the ransomware risk and then become more proactive for ourselves, for our vendors, and so on and so forth. Otherwise, it is very difficult. And the regulations and everything, will they make it better? I don't think so. Those are baseline, and there are like discussions about banning the ransom payments for healthcare, right? UK discussing that. We are discussing that in this country. I feel like they don't understand the pressure on the victims, and we are beyond the victim shaming, right? That was maybe like 10 years ago when there's a cybersecurity incident that was the case. Now people are investing a lot on cybersecurity, but the adversaries are getting better and better.
Mhm.
And they have more resources, more tools to attack us. So we need to understand the pressure on the victims when they cannot operate, when they cannot prescribe, medicines. Last night I was, working on something on my computer, and suddenly Google Chrome crashed and the Slack crashed, and I realized that it's because of a security tool that we are using, and I got frustrated. But I wasn't doing anything, uh, human life dependent thing, right? It was the regular
Right.
jobs that I am doing. I felt so frustrated at that moment, right? So then I start to imagine how much the medical,
Mhm.
professionals will see the pressure, like let's just pay the ransom and go with it kind of mentality. And the bad actors, they know that pressure. So the policymakers should understand that pressure first before making any policies about it.
Yeah.
Yeah, we keep hearing murmurings that they're going to ban ransomware payments. And years ago, when I worked sort of in advisory and incident response, I had one question that I started off with: Is it more important for you to figure out what happened, or is it more important for you to get back up and running? And 95% of the time, they want to get back up and running. And I think to your point, healthcare is somewhat unique in that, yeah, if you lose data, it would be bad, but you're talking about people's health and loss of life, and that is essentially incalculable from a risk quant perspective. And I think you're right in this. We've seen this over and over again. People who create laws and regulations don't really understand what it is that they are sort of regulating, and you would think they would have learned their lessons, but unfortunately not. So Bob, as a practitioner and someone who's led programs and sort of also been, hands-on keyboard, what are two or three things that CISOs broadly, but healthcare CISOs in particular, can and should be doing to at least lower their risk, minimize, have some impact, keep some of the bad actors out, be able to recover. So what are some things that you would suggest people sort of implement from a programmatic perspective? And Farhad, don't worry, I'm going to come to you from a more technical perspective in a second. But as a program
So,
leader, Bob, what do you tell people to do?
well, change their strategic mindset. Uh, and it's probably the hardest thing to do. I mean, you're a CISO and you've got your entire enterprise that you're worried about, and now you've got to worry about your extended vendors ecosystem, all the vendors that you really don't have a lot of control over. You've got a contract with them, but typically contracts are designed for after something bad happens,
Right.
who can we blame? So they're necessary, obviously, but that's the challenge. And it historically what we've done is we've looked at some very qualitative ways to go about looking at your vendors. You may not even you send out a questionnaire once a year, and that's a whole other topic. About asking questions that, well, we have to ask questions, we have to do this, and I don't think we have to. I think we have to find a better way to get the data that answers those questions, but without asking them. That's I'm working on a paper about that. Very first thing is start looking at, well, know your ecosystem, know your vendors, who's critical, who has your data, who's material to your operations, who's connected to your network, who's inside your house, who do you have a regulatory requirement that you have to monitor. Know that, but then kind of change how you think about looking at them, and the research, like the report that we've just given, having that kind of research at your fingertips and having the ability to be able to look. I talk about looking around the corner, and I've seen that in the space of security rating services, it's all about vulnerabilities. It's all about here's a list of vulnerabilities that your vendor has. Go fix all these things. And nobody can do that. I mean, a
Right.
CISO
And not
knows.
only not only fix them, but fix them tomorrow
Yeah,
or else.
yeah,
Right?
and
Not
and
reasonable.
and and the company that's asking you to do that, when you look at them, they have the same vulnerabilities.
Right.
So, having the ability and I am the CISO at Black Kite, and the tool I use is Black Kite. And if there was a better tool out there, I would add that to my toolbox. But the number one thing I love with vendors is and this comes out of the research that Bright has done, and that's the RSI, the Ransomware Susceptibility Index. If there's other tools out there that can do that, and you have them, use that. Do something. But for me, that's what I use primarily, and I think maybe we can share the link. We did a white paper on the Change Healthcare breach. How that research actually showed ahead of time that bad things were happening. So, that's the number. Use that type of tool that you can get that can help you see things that are really risky. A vulnerability is not a risk. A vulnerability is a component of risk. It becomes a risk when it's tied into, the opportunity, the threat actor. There's a lot of things, and RSI does that. It helps you to see that. So yeah, that. The other one is I think and I talked about prioritizing critical vendors. Obviously, we all know that, but uh, don't use the old way of looking at tier 1, tier 2, tier 3, because that old methodology puts so many vendors as critical that, well, you can't really focus on which ones are actually the riskiest. Which ones do pose the most risk to your organization. That's why I like factor analysis of information risk, because it's really about dollars and cents. And the last thing is, do something with your vendors before something bad happens. Because when something bad happens, the first thing you do in a vendor outreach is, who's the vendor relationship manager? And most of the time, you'll find out in your organization that vendor relationship manager probably has changed. So now you have to find the new one. And then the new one's going to give you a contact at the vendor, and you're going to find out, well, a lot of times that contact at the vendor has changed as well. So use a tool, use something that you can bring those vendors on board. I do it during onboarding, the identification of how we're going to reach out to them. We're making it part of our contracts so that when something bad happens, we know how do we get somebody engaged, from the vendor. It's a combination of those things. But the number one thing is changing your mentality, the agile, strategic look, the UDA, the observation that you can make decisions based on research, on good information, make decisions quickly, because I can guarantee you the bad actors are using it. They're using
Right.
that same concept, they're using that same process, but they're not bound by regulations, they're not bound by budgets. They're just out there doing this stuff, and they're doing it very well, and
I tell
great
you all the
place.
time, there are more bad actors than defenders. They have no no quandaries about morals or ethics.
Yep.
And we have, as defenders, need to be perfect, and they only need to find one hole. So, all right, Farhat, what about you from the more technical perspective? What are some of the controls that people should be putting in place that they're not?
Well, um, I will go back to the report and share one more stat about that. The top 10 ransomware group today, they were not in top 10 last year. Some of them didn't even exist last year. So you can see that how fast they can, climb up the ranks in the cybercrime ecosystem. In the last quarter, there were, more than 1,000 victims. The number of active ransomware groups last year was 30. Now it is more than 60. Now it doubled, right? So everything going on in the cybercrime ecosystem, but the one thing that doesn't change much is that how they infiltrate. They exploit vulnerabilities and they use social engineering attacks. These are the number two, methodology. Of course, there are open ports and everything, but top two is exploitation of vulnerabilities and the social engineering attacks. Even today, there was this ransomware report about a group called Ghost, and the initial access methodology is all vulnerabilities. I know that Bob said that vulnerabilities are not a risk. It's a technique that was used by these
It's part
groups,
of it.
right?
Yes, absolutely.
Yeah,
Yes.
and this is not like news to us, right? It's not like something that we discovered today. People are talking about AI and everything, right? They will improve their attack methodology. We don't see that. In fact, there is this new ransomware group. They climbed up the ranks very quickly, and they gave an interview. They said that they only use AI for phishing emails. That's all. They don't use that for sophisticated technical vulnerable to exploitation or anything like that. We are not there yet because they don't need to do that. They already have something that is working, and we are wasting our times talking about the policies and anything. Like, we need to focus on the things that we need to focus on.
Yes.
And calculating the risk is not that much complicated. When you calculate the risk, then you can make decisions, as Bob said, and be more proactive.
Right. Yeah. I mean, you hit on something there. I think that I always talk about hackers are like water, right? They're going to take the easiest way. They're lazy, but not in a bad way necessarily. Why would they work really hard when they don't have to? And to your point, there's so much of sort of not blocking and tackling out there. So, okay. So first of all, this was a great conversation. I'd like to thank Farhat and Bob for joining me today. Take a look at the report. Take a look at all of the other great research that Farhat and the Bright team do. Take a look at the blogs that we put out there. Bob does some, I do some, Farhat does some. We also have some great folks that work in Farhat's team that also do some stuff. So with that, I want to tell everyone to stay safe, stay healthy, stay secure. Black Kite out.